If you show up to your Spravato appointment unprepared, you're not just wasting the 2 hours you'll spend in that chair. You're actively working against your own treatment. There are 3 things that ruin a Spravato session. And before I tell you what they are, I need to show you something first. Something that's going to change how you think about all 3. By the end of this video, you're going to understand exactly why your clinic asks you to do certain things before your session. Not just the rules, the actual reason behind each one. Because once you understand why, you'll never forget what. So, Spravato is the brand name for a medication called esketamine. It's related to ketamine, and it's approved for depression that hasn't responded to other treatments. Here's the simple version of how it works. Your brain runs on a chemical called glutamate. Think of glutamate like water flowing through a river system. And that river system is basically how your brain cells talk to each other, how you learn things, remember things, regulate your mood. Now in depression, that river system can get stuck. Certain paths just stop being used. It's like a road that's been closed for so long, grass has grown over it, and your brain just stops sending traffic that way. Here's where it gets interesting. Esketamine temporarily blocks a specific docking point in the brain called an NMDA receptor. Think of it like a toll booth that glutamate normally has to check in at. When Spravato blocks that toll booth, glutamate backs up and then floods out through other routes instead. That flood does 2 things. First, it can make you feel noticeably different really quickly, sometimes within hours, which is unusual because most antidepressants take weeks to do anything at all. And second, this is the important part long term. That flood helps your brain build brand new roads. Doctors call this neuroplasticity. Basically, your brain's ability to lay down new paths instead of relying on the old, overgrown ones. That's the upside. But here's the part that actually matters for how you prepare. While that flood is happening, your brain and body are in an unusual, temporarily altered state. And that's not some side effect they forgot to mention to you. That is the reason every single prep rule exists. Every rule you're about to hear is built around managing that 2-hour window. All right. Thing that ruins a session, number 1, eating too close to your appointment. Remember that flood we just talked about? Well, one place it shows up is your inner ear and your stomach's balance signals. The same system responsible for motion sickness. That's why nausea is one of the most common effects of esketamine, especially in the first 30 to 90 minutes. Now combine that with sedation. Feeling drowsy, kind of drunk-like, which also commonly happens. If you're nauseous and drowsy at the same time, and you've got food sitting in your stomach, there's a real risk of vomiting while you're not fully alert. And that's not just unpleasant. Clinically, that's a risk clinics actively work to prevent. So the rule is simple. No food for at least 2 hours before your dose, and no liquids for at least 30 minutes before. That's not some arbitrary inconvenience. It's your stomach being empty enough that even if nausea does hit, nothing dangerous happens. Here's what to actually do. Eat a light meal 3 hours before your appointment, then stop completely. Sip your water earlier in the day, not right before you walk in. Okay, number 2. And honestly, this is the one people underestimate the most, assuming they can just drive themselves home. Remember the glutamate flood? While it's happening, your brain temporarily processes coordination, depth perception, reaction time differently. Clinically, this is called dissociation, a feeling of being disconnected from your body or your surroundings. And it can stick around for a while after you leave, even once you feel, quote, mostly normal. Here's the number that actually matters. The FDA specifically requires that after Spravato, patients avoid driving or operating machinery until the next day, after a full night's sleep, not just for a couple hours, the entire rest of the day. That's how long these effects can linger below the surface, even after you feel back to yourself. This is exactly why Spravato is only given inside specially certified clinics under something called a REMS program, a safety system the FDA requires. Part of that system means you're monitored on site for a minimum of 2 hours after your dose, and staff won't discharge you until you're clinically stable. Most clinics won't even administer your dose if you don't have a confirmed ride arranged in advance. It's not a suggestion. For a lot of clinics, it's a hard stop. So here's what to actually do. The night before your appointment, before you go to bed, confirm your ride home. A person or a rideshare booked for a specific pickup window. Don't leave it to figure out in the morning. And remember, it's not just the ride to your appointment. It's no driving for the rest of that day. And number 3, not telling your clinical team about everything you're taking. This one's actually simple once you see it through the river analogy. Some substances change how fast that glutamate flood moves, or they stack additional sedation on top of what Spravato already causes. So specifically, your clinic needs to know about benzodiazepines, anti-anxiety medications, because they can blunt how well Spravato actually works, opioids, sedatives, or sleep medications, because combining sedating substances can compound drowsiness, and in rare cases, slow your breathing. Stimulants, because they can push your blood pressure even higher than Spravato already tends to. And alcohol or recreational substances, which your clinic will typically ask you to avoid for at least 24 hours before your session, for pretty much all the reasons we just covered. There's also blood pressure to think about, separately from medications. Spravato is well known for causing a temporary spike in blood pressure. That's actually printed right on the medication's official warning label. Some patients see their systolic number, the top number, jump by 40 points or more in the first 90 minutes. That's exactly why blood pressure gets checked before your dose and monitored the entire time you're in the clinic. And if your baseline blood pressure is already high walking in, your clinician may need to make a call about whether to proceed that day at all. None of this is your clinic being cautious for no reason. Every single one of these checks exists because of something specific and measurable that Spravato does to your body during that window. So, now that you know why, here's what to actually expect, minute by minute, so nothing catches you off guard. In the first 30 to 60 minutes, sedation tends to peak. This is when you're most likely to feel drowsy or drunk-like. Dissociation, if you experience it, is usually strongest in this same window. Around 90 minutes in, your blood pressure and how you're feeling gets reassessed. Most people are already leveling out by this point, and by the 2-hour mark, a clinician does a final check. Sedation, dissociation, blood pressure, breathing. They only clear you to leave once you're stable. In clinical studies, the overwhelming majority of patients, more than 9 in 10, were ready to go home right at that 2-hour mark. A small number need a bit more time, and that's completely normal too. It just means staff are doing exactly what they're supposed to be doing. Quick tip: wear comfortable clothes you don't mind sitting in for 2+ hours. If you tend to get anxious in medical settings, tell staff before you're dosed. Ask about headphones, a blanket, or dimmer lighting if your clinic offers it. And walk in with one calm thought or intention you want to sit with. You don't need a plan for the session itself, just something grounding to start from. Okay, let's put it all together in order. And now you actually know the why behind every single one of these. The glutamate flood is the reason Spravato works so fast, and it's the reason your body needs 2 hours to come back to baseline. That's why you stop eating 2 hours before and stop drinking 30 minutes before. An empty stomach in case nausea hits. That's why you can't drive yourself home, not just for 2 hours, but for the rest of the day. That's why you disclose every medication and skip alcohol for 24 hours, because some substances stack right on top of effects Spravato already causes. And that's why blood pressure gets checked before, during, and after, because it's one of the most measurable things Spravato does to your body. Nothing on this list is a random rule. Every single one traces back to that one flood of glutamate we talked about at the very start. If you want all of this as a simple checklist, screenshot this frame right now or grab the printable prep sheet linked below. Tape it to your fridge the night before your next session. And just a quick note, this video covers general preparation guidance. Always follow your specific clinic's instructions and talk to your care team about your individual situation.